my name is Courtney. I'm one of the registered technicians here at PetVet Animal Hospital, and today I just want to talk to you guys about oral health or dental health in our pets and why it's important. Every time you guys come in, we do an oral health exam on all of your pets just to ensure that their teeth are looking the way they should. We care about this a lot just because dental health in animals was overlooked for a lot of years, but just like in humans, dental health is really important to prevent a lot of different diseases, like systematic diseases like heart disease. It can affect their kidney and liver. It also causes a lot of bad breath, which is the complaint I hear the most from pet owners is, oh, my pet has a lot of bad breath. Some of it is because they're an animal, they eat things you and I don't normally eat. Usually they don't brush their teeth on a regular basis. But if they have an overgrowth of bacteria and calculus and gingivitis in their mouth, that can also cause a lot of bad breath. So when you bring your pet in, we're gonna look in their mouth and we're just gonna evaluate some key points. We call it periodontal disease, and we will give your pet a grade on where they're at with their periodontal disease. All right, this is Reagan. So she has, we're just gonna do an oral examination on her just to see where she is with her periodontal disease. I talked about how we're gonna give them a grade. So a veterinarian or a veterinary technician, when they do an examination on the pet, they always look in the mouth. They'll lift the lip a little bit, and I know you wanna give me kisses, I know. So here, we're looking at the gum line here, right around the teeth specifically, just to make sure there's no redness or gingivitis forming there. There's no swelling or anything like that. She does have a little red spot right here, so that's a place I would need to watch to make sure she doesn't have any gingivitis. I'm also looking to see this yellow stuff here on these teeth specifically, but it can build up on all of them. But that is actually tartar and plaque building up on her teeth, and if I don't brush her teeth on a regular basis, that can turn into calculus, which we actually have to put them under anesthesia and scale that off their teeth once it forms into calculus. The veterinarian won't look at just one side of the mouth because she has two sides, and one side might be worse than the other depending on how she chews, so I'll look at the other side as well. And I see on the same teeth, it looks like she has a red spot there, and she has some plaque and tartar buildup. So with her, looking at this particular what she's got going on here, she doesn't have a ton of gingivitis, she doesn't have any calculus formed there. She would be what we call a grade 1 periodontal disease, meaning we could probably brush her teeth and minimize the amount of progression with that particular condition. If she were to get any worse, then she would need to be put under anesthesia, and we would have to address it by professional cleaning with scaling and x-rays and things like that.